Bismillahirrahmanirrahim. Today we will have a rheumatology capsule titled Classification Criteria in Rheumatology. First of all, what is meant by classification criteria? Classification criteria means a set of criteria used to classify each patient as to be or not to be included in certain category of disease. It is not diagnostic criteria, it is not 100% accurate. It is classification. Classification criteria are used primarily for research purposes to classify, for example, 50 patients as rheumatoid arthritis. So I will have this research for these patients and not for other who don't fulfill the criteria. But for individual diagnosis, we may not be strictly following the classification criteria. We are not just fill in space for diagnosis of any patients according to the criteria. It is only used as a guideline or guidance. Classification criteria in rheumatology. Why we use classification criteria in rheumatology? The answer is because there is no diagnostic test or laboratory or imaging for the diagnosis of any rheumatic disease. For example, a blood pressure of, for example, 400 is diagnostic for diabetes mellitus. A blood pressure over 140 over 90 is diagnostic for hypertension. But there is no specific test to diagnose or exclude any rheumatic disease. So we use classification criteria. So, what is the characteristics of good classification criteria? We see that every few years the ACR, the AULR, or both, or other organizations will produce or update all the criteria with new criteria. So why? Because there is some disadvantage of the old criteria. I will update to improve the quality of these criteria for the classification purposes for the disease. So the characteristics of good classification criteria include high sensitivity. Sensitivity means the ability of the criteria to catch positive cases, to catch true cases. So higher sensitivity means this criteria can catch more and more percentage of the diseased patients or diseased persons. So, for example, classification criteria for rheumatoid, if it is sensitive, it means it will catch all or most of the cases of rheumatoid. It will not miss. This is the sensitivity, the ability to catch positive cases. Also, criteria to be good should have high specificity. High specificity means the ability to exclude negative cases. The ability to exclude negative cases. Criteria, if high specificity, it will not be positive with negative cases. It will catch good the negative cases. So we can say when on the other word that sensitivity means good negative test. Sensitivity means the ability to catch positive case. So if the case is negative, if the criteria is negative, which is sensitive, so negative means negative case, but positive may not necessarily means positive, because the disease is the criteria is sensitive, catching the positive cases, but may catch also negative cases by mistake. So it is sensitive, catch positive, but may also catch negative cases. So it is good negative. If it is negative, it means nearly there is no disease. The specificity is the opposite. It is a good positive test. It is the ability to exclude negative cases. It excludes all negative cases, but may exclude some of the positive cases. So if it is positive, it means the patient has this disease. Good criteria should have both high sensitivity and high specificity. Means if it is positive, it means the patient has this disease, and if it is negative, means the patient don't have this disease. Also, the ability of the criteria to detect early cases. It is not a good job to diagnose rheumatoid arthritis in the stage of deformity. It is not wise to diagnose systemic lupus in the diagnosis of renal failure or advanced renal disease. But I should detect these diseases as early as possible to prevent these complications. So if the criteria can detect early cases, it is good criteria. Also, it should be easy to perform. It shouldn't be so complicated. The more the complicated the criteria, the less applicability of it in the clinical and even research purposes. And finally, it shouldn't cost you. And the cost here is a question mark because we should compare between the cost of the application of criteria. For example, if we need MRI, CT, or some laboratory which may be expensive, such as ANA, anti-double strand, ANA profile, and so on. We should compare this cost with the cost of leaving the patient underdiagnosed or undiagnosed until being advanced in the disease. So, characteristics of good classification criteria: high sensitivity, high specificity, can detect early cases of the disease, easy to perform, and not costly. You should notice that any classification criteria which can achieve 100% sensitivity means no cases are missed, and 100% specificity, which means no normal persons are diagnosed by mistake as this disease. So 100% sensitivity and 100% specificity. Any criteria which can achieve these 100% values will not be considered more as classification criteria and will be considered as diagnostic criteria. So the difference between classification criteria and diagnostic criteria: classification means the sensitivity and specificity doesn't reach 100%. But the diagnostic means this criteria have 100% sensitivity and 100% specificity. The general rule is when I increase the sensitivity of the criteria, I will decrease the specificity, and vice versa. So it is very, very, very hard to achieve 100% both sensitivity and specificity. And in fact, in the rheumatology, in all rheumatic disease until now, 2024 year AD, there is no diagnostic criteria in rheumatology. All of our criteria are still classification criteria, and this is a rheumatology capsule. Wassalamu alaikum wa rahmatullahi wa barakatuh.